Hi, I'm Dr. Sunil Munshi, consultant physician from Nottingham University Hospitals. When we talk of geriatric giants, stroke disease rates right at the top. This is all the more important as the proportion of older people in the community is increasing every day. In fact, if you look at the average age of our stroke patients, in the Midlands, it's 78.1 years. This is very important as the management of these patients becomes completely different from younger stroke patients. Where should stroke patients be treated? The Stroke Units Trialists Collaboration Study, which was a review of more than 23 stroke unit trials, clearly proved that stroke patients should be treated on stroke units. Stroke units decrease mortality, morbidity, readmission rates, and improve survival. Who should deliver management of stroke patients? Well, on the stroke units, the management of stroke patients is delivered by the multidisciplinary stroke team. This team comprises of doctors, nurses, physiotherapists, occupational therapists, neuropsychologists, pharmacists, dietitians, and numerous other people. But the fulcrum of the whole team is the patient, who is right at the center of this core group. There is evidence from randomized controlled trials that education of multidisciplinary team staff leads to better patient outcome. On the basis of this, we developed an educational course which is called the Nottinghamshire Multidisciplinary Stroke Course. Although we have been delivering it for the last 4 years, but over the last 6 months, with the help of assistance from the East Midlands Health Innovation Education Cluster, the Nottingham University Hospitals, and collaboration with the Educational Department of Pfizer, we have managed to deliver a high-quality course in the last 6 months and are continuing to do so. The course caters to all therapy staff, nurses, namely physiotherapists, occupational therapists, psychologists, even community teams like practice nurses, care home staff, and in the future, this is going to expand further. The course is currently being held about 5 times a year and over 3 weekdays. Day 1 comprises teaching on neuroanatomy, physiology, NIHSS, thrombolysis, complications of stroke, palliative care and end-of-life pathways, and the role of the hyperacute stroke nurse. Day 2 comprises rehabilitation teaching. This is an excellent educational day involving teaching from physiotherapists, occupational therapists, speech and language therapists, and Day 3 is which is entitled Stroke and the Real World, involves a session from a former stroke survivor, Mr. Ossie Newell, or other patients may be involved in the future. Then we also have teaching by the advanced nurse practitioner who talks about TIAs and lifestyle advice. And there's also a talk from the pharmacist. The session concludes with an excellent session from the early supported discharge team. So these are the people who deliver the talk. Now, what are the outcome measures of this course? How do we measure our success? Well, we've got very well-defined criteria, and we also have received regular feedback from the audience. On the basis of this feedback, we improve our course every day. It's ever evolving, so to say, and we incorporate the lessons we learn from these feedbacks. And in fact, the outcome measures that we use also involve mortality rates, morbidity rates of patients who are admitted or seen in outpatient clinic, length of stay of patients, readmission rates, and even staff retention levels. which gives us an idea about the morale of the staff. And what does the course hold for us or for everyone else in the future? Well, I'm convinced that with the support of the East Midlands HIAC and NUH and Pfizer, we will be able to expand the course throughout East Midlands and involve lots of NHS trusts in the East Midlands. We'll involve practice nurses, more and more community staff, and even care home staff. This will be of great benefit to patients.